Tim. See if I can do that. Hi, Tim.
Hi, how's it going? Well, thank you
Good.
so much, Matt. Sorry about that. Thank you so much, Matthew. That was really, really beautiful, and I'm just really honored. One just to hear, the authenticity and the transparency of how you share your story, and it's a reminder to me that just the power of hearing about somebody's story and their resilience, and I think oftentimes you made mention of how frequently we naturally just compare our experiences to what we perceive other people's experiences are. And you were using that example of walking by the bar and you're looking inside and you imagine that these people are having this particular type of experience, and that you want to have that experience. And it's a reminder, and I talk to people about this all the time, is so often I think that we imagine that we find ourselves so frequently falling into these places of doing lots of comparing ourselves, comparing to others. I'm sure some of you have heard that expression that I really believe in, which is that comparison is the death of joy. The idea that that really the things that make us feel most connected to each other actually are those authentic, vulnerable parts of ourselves. And unfortunately, when people, fortunately, when people let us in the way, Matthew, that you have let us in, it actually gives us all permission to be those parts of ourselves. And I think so much of recovery is actually about connection and sort of being able to be our true authentic selves. And I think more often than not, putting aside, what psychiatric issues people are dealing with or what addiction issues they're dealing with, I think one of the most common themes to the experience of suffering is isolation. And whether we are literally isolated or we just perceive that we are isolated from the people that are around us. And so I just want to really express an appreciation for you sharing about, your experience and strength and hope, and giving me the opportunity to follow up. As was mentioned, I am a licensed clinical social worker. I'm a psychotherapist. I've been in practice for almost 20 years, and I work in lots of different settings with lots of different clinical presentations. But one of the things that I feel really most passionately about is working with folks with co-occurring substance abuse or addiction and psychiatric or mental health issues. And for the sake of full disclosure, a huge reason for the reason that I care so deeply about these issues is they've had a direct impact on my life and the people that I love and care about. And so I want to be able to share that because I think that I know how important it is and can be to see people make those transformations. And I know how painful and difficult it is to be in the circumstances where you're really struggling or someone you love and care about is still struggling. And so I want to just sort of name that a little bit. And then I'm going to try, I had a whole variety of different things to talk about, but I want to kind of piggyback on some of the things that I think Matthew shared, and certainly maybe add to them or add my perspective as a therapist. And I wanted to start by sharing a quote about recovery that I think is really, really relevant to this conversation about self-care versus self-medication. So the quote, and I unfortunately, like many, many quotes that we use in this world, in this specific world around addiction and recovery, I don't really know what the original source is. It is not mine. So that's the main takeaway. But it's the quote is, "You don't get over an addiction by stopping using. You recover by creating a new life where it's easier to not use. If you don't create a new life, then all the factors that brought you to your addiction will catch up." So I'm going to read that again. So you don't get over an addiction by stopping using. You recover by creating a new life where it's easier to not use. If you don't create a new life, then all the factors that brought you to your addiction will catch up. And the reason that I think this is, in my opinion, in my clinical experience and personal experience, why this is so relevant is that oftentimes when people are coming into treatment whether that's a drug and alcohol treatment program or just therapist or psychiatrist, oftentimes there are particular behaviors that have disrupted their lives, their relationships, their work, whatever it might be, and that is the primary focus. And absolutely, I believe that more often than not, those issues are often urgent and they're sort of a crisis, and those need to be the areas of focus to sort of stabilize those behaviors. But what this quote really says to me, and what I really believe, is that ultimately long-term recovery is about a lot more than just stopping those behaviors. And I think, Matthew, that's what you really highlighted in sharing your story, is that and so for any of you who have sort of have some familiarity with 12-step or AA, there's a lot of discussion about the difference between being in recovery and being dry, right? So being dry is you've just stopped the behavior. But more often than not, if you've experienced somebody who is sort of white knuckling and they've changed the behaviors, but they haven't done any of those other pieces of self-care or work, oftentimes they're suffering still. They might not have the same consequences in terms of getting a DUI or getting arrested or whatnot, but their quality of life generally has not significantly improved in the way that it can when you're able to sort of move towards a place of recovery. And so I really kind of want to emphasize that. And so what I think about as that, the other thing I would say about that quote that I think really highlights the difference between self-care and self-medication is that I really believe that addiction typically begins as a coping mechanism to manage emotional pain. And certainly there's different circumstances of what that emotional pain looks like. But that's usually, it starts as a solution, right? And most people, in my experience, if they're using a drug and alcohol or a particular addictive behavior, it's to try and escape distress and suffering. And I believe that people use the skills they have. And so it's easy, for Matthew, somebody who's done tons of work on themselves and really made this transformation, to look back at other points in his life and say, well, I should have done, or I could have done something different at that moment. But I would bet, not that I have the ability to travel back in time, but if we did travel back in time and we told Matthew, hey, this is going to be the outcome of some of those behaviors, it's probably safe to say he would have made a different decision, right? And so I think it's important to sort of recognize that we use the skills that we have. And I really see recovery, and certainly whatever part I play in someone's recovery as their therapist and part of their support system, it's really about how do we develop alternative, healthy ways to get those needs met. Whatever need that the original addiction was sort of trying to address, that need is not going to all of a sudden just go away. In my experience, for the most part, there's really going to still need, but it's about getting it met in a different way. And how do we sort of support someone in sort of making that transformation and doing those things? And so I think that the other thing that really stood out to me that in Matthew's share that I think is something I hear really, every day when I'm working with people is how intolerable distress is, and how difficult it is to experience distress, and the power of and oftentimes the lengths that we will go to get out of distress, and sort of that we will oftentimes, and I think a lot of the behaviors that we're talking about as it relates to substances and addiction are often about trying to do something to resolve whatever distress we're feeling. Obviously, intellectually, I can argue that most of the time when we're doing that, we're kicking the can down the road and we're not necessarily really addressing the thing that's causing us distress, but we seek and want relief. And so I think for a lot of people, self-medication is often oriented around the desire or need to address whatever distress we're feeling as quickly as possible. I think that self-care is often about, and this partially is due to how I approach it. Different therapy approaches would obviously address this issue in a slightly different way, but I would name it as distress tolerance skills. And so oftentimes, when we're struggling with something, our human instinct is we want to solve that problem. The reality, and frequently, is that there isn't an immediate solution to those problems. And that actually the skills or tools that are needed in those circumstances are distress tolerance skills. And usually that is skills that aren't going to solve the problem. But at the very least, the first goal is usually they don't do anything to make it worse. Right. And so oftentimes, I think about how, and this is maybe not the most exciting way of describing it, but when I'm talking to people who are in crisis, they're kind of in that pivotal moment where they're really suffering, I point out to them oftentimes that really the goal in those moments is not to feel better or to solve everything. It's to slow down and not do anything that could make things worse. And the nice thing about that, from my perspective, I certainly don't want to make light of the fact they're in distress, but like from my perspective, I think one of the things that can help people in those moments to hear something like that is that feels a lot more manageable. Right? Because part of what escalates our distress is those moments where we feel stuck, and we imagine that where there isn't a solution that's going to alleviate that pain. And then oftentimes in certain instances, people will sort of end up in that kind of thinking of like, why bother, throw their hands up, there's more graphic ways of describing it, but certainly you get the idea that people, kind of decide like there isn't a solution. But I think for most people, it does feel like, I'm really having a difficult time, but I do have the ability to slow down and not do anything to make it worse. And so when I think about, I was thinking a little bit for this talk, like how would I actually define what self-care is? And backing up a little bit, I think the good news is that self-care is way more part of the cultural lingo now than it was, at least when I first started doing this work, which is beautiful. The limitation and challenge of it is I think it's gotten so pervasive that we talk about it and we assume we all know what we're talking about. We don't ever really define what we're talking about, at least in my experience. And so when I was thinking about like how I would define it, self-care, in my opinion, is activities, routines, and habits that anchor us in our psychological safety or our healthy parts of ourselves. And that most examples of self-care aren't immediate solutions to whatever we might be struggling with, but they do help connect us to our internal and external resources to manage our lives effectively as possible. And so it sort of ties into what I was talking about in terms of that distress piece, where certainly I know that you guys are very well aware about the benefits and importance of routine around sleep and appetite and exercise and all of those things. Of course, exercising is not going to account for the loss of a relationship, or it's not going to solve that problem, right? Or it's not going to deal with difficulty at work or difficulty with the neighbor or the kinds of life challenges that come up. But it's going to help us stay grounded in the parts of ourselves that actually do know how to navigate those things effectively. And so part of what I really took away from Matthew's story that is really empowering for me, and I suspect for others, is that what I did not hear Matthew say is everything is like rainbows and unicorns and wonderful and like I can manage everything. It was, no, I can actually live life on life's terms. Like I can feel connected to the things that are important to me. There's going to be difficult moments and challenges in my life, but I'm okay because I have those self-care routines, and I have those habits, and I am what I would describe as internally resourced, where I know that I don't have to account for what's going to be the thing that can push me over the edge, but really in a place of like, as things come up, I know that I'll be able to connect with the things that are most important to me, which I think is really, really powerful. So I certainly appreciate that. The other thing I wanted to bring folks' attention to that isn't necessarily specifically about self-care or self-medication, but I think does really speak to and validates, I think, a lot of what Matthew shared about, and probably some of you are familiar with this, but I want to just sort of highlight it And I don't actually know how well this is known outside of the US because it was a study that was done in the US. But I suspect this has been replicated, or maybe it was even done first outside of the US. But so the study that I wanted to reference is the Adverse Childhood Experiences, or ACEs, if folks are familiar with that. And so just in a nutshell, in the late 90s, there was a study done by the Center for Disease Control and the Kaiser Permanente Foundation. They surveyed, I think it was like almost 20,000 people about their childhoods. And they asked about sort of these 10 different categories of childhood adverse experiences. And what they looked at was that the number of adverse child experiences you've had directly correlated to higher risk behaviors, health outcomes, and just sort of overall life outcomes throughout your lifespan. And so part of what I want to, I share that for two reasons. One, I think it just really validates that, that these issues, in my opinion, don't come from nowhere. There is absolutely a genetic component to addictions and whatnot. And I think I feel very confident, and I think most people would agree, that we also know that there are lots of environmental factors that contribute to these things. And when I'm talking about the adverse childhood experiences, the kinds of things we're talking about are, different types of abuse, neglect, if there was serious mental health issues in the home, if there was divorce or separation, if there was incarceration, if there was substance abuse issues in the home, that all of those things are certainly an impactor. Oh, thank you so much for sharing that TED Talk. It's a great one. And so I really want to emphasize just that in my opinion, so more often than not, that we talk about co-occurring disorders or substance abuse and mental health issues as sort of the special exception. And I would really say that that's actually the wrong way of thinking about it, because the vast majority of the people who have a substance abuse and addiction issue absolutely have a psychiatric issue. And I would argue more often than not have some semblance of a developmental trauma, or at least multiple childhood adverse experiences. And I think there's two components to that are really helpful, in my opinion. One, I think it really gives us an indicator that part of the work that people like I am doing and other folks that are out there doing peer support and doing help, like there's a version of our work that needs to start way earlier, right? And sort of be addressing these things much, much earlier in life, and that we need to create systems that actually do a better job of addressing these things or preventing these things, I would argue. But that also, it's, I think, really empowering, and like Matthew said, to have an understanding that so many of these issues I see when individuals are experiencing, there's a tremendous amount of shame about them. And we do talk about them as if they're moral diseases, that the people that have these problems are morally flawed, and that's why they have these problems. And there's zero evidence to suggest that that's the case. But it's still something we continue to experience. And that's even with, I think we've made a lot of progress in the last 20 to 30 years around stigma. But I think we also have a long way to go. And so I wanted to sort of comment on that. And then the two other things I wanted to say, and I know that I think Matthew and I were going to come together to talk a little bit before we do questions, was something that, two things that I think Matthew named that I thought were really powerful, in my opinion. So one was, oftentimes I think we want to imagine and think about psychiatric issues and substance use issues or addiction issues as the way we think about the flu, right? Or strep throat, where it's like, oh, I have a problem, I have a symptom, I go get treatment, and then I move on with my life. And I think it's important to recognize that a lot of these issues are chronic conditions, and that actually that a lot of the self-care routines that we're talking about are not really that different than how we talk about managing type 2 diabetes or managing high blood pressure, which is you build in the routines of the things that you're doing every day so that you minimize or eradicate symptoms, not you wait till you get symptoms and then you address those difficulties. And so I think that, and I don't say that, I suspect there's a lot of people in the this is like, duh, I know you know this firsthand for yourselves, but I find myself talking a lot to loved ones and family members about this, because the loved ones and family members don't get it. They're thinking about, like, well, I don't understand why they seem fine. Why do they need to keep going to these meetings? Why do they need to keep taking these medications? Why do they need to keep going to therapy? And part of the thing that I talk to those folks about is, well, they're doing those things to maintain habits and routines that keep them connected to their psychological wellness, so that they either don't have symptoms, or the symptoms that they have are more manageable and sort of more accountable. And then the last thing I wanted to say before we get to questions is something that's not related to self-medication or self-care, but something that I want you all to know from my perspective as a therapist. And it's something Matthew said that really made me think about it, is that I think is really, really powerful, was your recognition, Matthew, that you tried different types of therapy, and there were certain approaches or certain people that weren't the right fit. And I want to really, really, really put in a shameless plug as a therapist that that I encourage all of you and your loved ones and the people that you care about to think about therapy not going into therapy with the assumption that this other person knows what they're doing and this other person is going to tell me what I should be doing, and I just need to be passive and listen. And if I'm not getting what they're presenting to me, or it's not working for me, there must be something wrong with me. And the reason that I say that is that, one, not a shocker to anybody, mental health, I know it mostly in this country, but I think we'd probably safely say not just in this country, has a pretty sketchy past, right? There's lots of behaviors and treatments that at different times we were like, yes, that's a really good thing to do. And so I say that I think it's helpful to have a little bit of skepticism, and I think it's helpful to approach treatment from a perspective of, you as a person, you might not be an expert in a particular disorder or a particular model or intervention or treatment, but you are an expert in your experience. And in my opinion, my approach to therapy is that really the most effective version is where I collaborate with the person that I'm working with, where I'm bringing the things that I might be an expert or knowledgeable about, and they're bringing the things that they're an expert and knowledgeable about. And it's that joining together to really work towards recovery. And where I say this is really important, just like a really tangible way to approach this, is I encourage people, when you're going to go to talk to somebody about joining a group, or you're going to talk to somebody about therapy, come with questions. Ask them. It's totally reasonable to ask someone, hey, this is what's going on for me. How would you understand that? And how might you go about helping me? And again, they're just getting to know you. They might not have a perfect answer for, what the next year of treatment is going to look like, but you should be listening for, like, are they talking about this in a way that aligns with how I think about this? Are they talking about this in a way that aligns with what I'm looking to get out of this? And just for those of you that want like the evidence base for this, there was a bunch of study done now probably about 30 years ago, where there was a psychologist who was very curious about how therapists know if their patients get better. And they went and they surveyed a whole bunch of therapists, and they said, well, do your patients get better? Not shocking at all. Vast majority of people said yes. And they said, well, how do you know? And they said, well, I just know. Or they said things like, well, they don't come back, which is a really interesting way to determine that someone's doing well. And there's all kinds of different ways that people establish that people are getting well. So this person doing this study got really interested and basically boiled down what they called goodness of fit. And what he found was essentially that they looked at a bunch of different evidence-based therapy models and found that they were equally effective. But the distinguishing factor between when people got better or benefited from treatment were sort of boiled down to three categories. One, did the person feel like they were talking about the things that were most important to them? Two, did they feel like the therapist understood what it is that they were needing or wanting and respected that? And then three, was there agreement about what we were working on, the therapist and the patient? And what's most interesting to me about this concept of goodness fit was the good outcomes was not necessarily that the patient said yes to all those things. It was that they were asked. And so it really speaks to the value of that relationship and the importance of being able to have an ongoing dialogue and a conversation, whether it's with your psychiatrist, whether it's with your therapist, whether it's a group facilitator, whoever it is, about, hey, I'm not sure, like, what are we working on? Or I'm not totally sure that I'm getting what I'm needing or wanting out of this. And I think just really encouraging people to see it, feel empowered to be an engaged consumer of the support because it's yours. So I realize that doesn't necessarily have to do with self-care or self-medication, but I wanted to just give a shameless plug. And thank you so much for the time.
Thank you. That was amazing. And I do think, as a fellow therapist, that's not a shameless plug. It's brilliant. So many people give up on therapy. They give up on treatment because it's not the right fit, as you said. And it's an old Bulgarian saying, there are passengers for every train. So there is some kind of help out there for you. So I had some really great questions in the chat. Some for one of you, some for both of you. Let's see if I can't pin Matthew and, oh, there we go, Matthew and Tim. Wonderful. So if you just give us like in the interest of time, like a brief answer to some of these questions. So Matthew, how were you able to navigate through a relationship while still being on the road to recovery?
Well, the simple answer is that it was hardly navigation, really. We broke up a lot, and I think the truth is, I always knew. Gosh, yeah, good question, because I can feel it right now. I always knew that my wife was my closest ally and my closest companion. And I remember one particular situation where I was very unwell, and I was practically fighting to get out of the family home because I wanted to leave, because I just couldn't be there. And actually, she very bravely, she very bravely hugged me. And I think, Tim, you can probably talk a little bit more about that. And it broke through my defenses. And I remember the psychiatrist once said to me, you've learned to survive. You've learned to survive, and you're trying to protect yourself. And I was doing that even as an adult. And my wife never gave up. So I think it's less about me navigating through it and more about her love for me. And I'm very grateful. And had I have not navigated through it, I don't think I would have my understanding of what a proper relationship is now. I'm absolutely. I've got two beautiful kids, lovely wife, and yeah, I'm absolutely grateful that somehow we got through it. But I don't think I navigated. It wasn't down to my intellect or down to my strategy. I think it was mostly down to her not giving up, and I gave every reason for her to do that. And at times we did break up, but we've managed to come through it. So
wonderful. And for either of you, what are your tips for supporting a loved one struggling with addiction?
Tim, do you want to go first, or should, what do you
think? Yeah, either way, I think it's a great question, and I think so. I think that the question that I often, one, I think it's an incredibly challenging circumstance to find ourselves in. To sort of trying to be a love and support. I think that oftentimes these addictions really bring out the kind of the most unlovable behaviors in the people that we care about. And the thing that I really try and remind people of is one, getting peer support, and whether that's at in DBSA or going to Al-Anon, or whether that's going to family through NAMI. I think it's really, really invaluable to get connected to other people who understand. And then the big thing I think is oftentimes in my experience, more often than not, the conflict around being supportive is the person who's still struggling has a version or a vision of what support they're needing and wanting, and you as the loved one have concerns about whether or not doing that thing is actually going to support them or not. And so I think oftentimes, the classic example is somebody's calling up and saying, hey, I need money. And your feeling is like, I feel like if I give you money, that's not actually going to help you, be stable and supportive. And so I encourage people to recognize that you as an individual get to determine and decide what support you believe will be helpful for the person, and that you get to decide whether or not you're willing to offer that. And you can't necessarily control that is going to be received by the person who is struggling, but that doesn't mean that you're not being a support for them, if that makes sense.
Yeah, that makes great sense.
Um,
Thank you. And also for both of you, what's your opinion about harm reduction versus abstinence? So harm reduction being basically trying to go from one harmful behavior to something that might still be harmful, but is less harmful, versus abstinence, which is, no drugs, no alcohol, no addictions at all. And Matthew, how did
Well,
you
I think-
decide that abstinence was the right path for you?
Well, in that situation, I didn't decide. It was literally the only way I could stay out of a custodial sentence. Honestly, I mean, I went to court on that day. I didn't finish that story. I was almost very much, going to prison, and only because of the abstinence and only because of the commitments I'd made and all the tests that I'd done, did I manage to build up a good picture of my character that just sort of managed to get me out. So I didn't choose to abstain. But actually, I think the truth is, I couldn't have abstained if I tried. It wasn't abstinence. Tim said this. I mean, I couldn't stop, because if I stopped one thing, something else was going on. I was literally chasing my tail. The thing is about this is that I wasn't in the driver's seat of my life. I was being pulled through life by these impulses and these addictions. So it wasn't, for me, it wasn't a matter of just making a decision. It was more of a case of, I think, having to be very vulnerable and asking someone like Tim, actually, how do I do this? I mean, it was really, how do I do this? And when I was so ashamed of, so I was diagnosed with bipolar disorder, and I thought, actually, now having this substance misuse problem, and then I heard these people say it was, you've got two disorders now. I was thinking, oh my God, does this mean that bipolar is going to be taken? I actually remember thinking, does this mean bipolar is going to be taken away from me? Does this mean that is no longer true? And actually, it's because I started taking drugs early, and it threw me into. So I think the ability, Tim, you mentioned, to be able to actually build up the confidence to say what you're thinking, to say how you feel. So I'm ashamed, and I feel like I'm going to lose bipolar. I mean, who wants to say? Of course, who wants bipolar? So why should I be afraid to lose bipolar? But I think that honesty, Andrea, and that relationship. So I think that's what helped me to orientate myself during the abstinence to my relationship with moderating these behaviors, if that makes sense. So it's like I kind of learned my way through the process. So I guess if other people go through the process, or I'm quite confident that they'll figure out what's right for them, and it could be abstinence, and it could be actually that they manage to moderate their behavior sufficiently enough to do what Tim suggested, which was respond differently in some scenarios, to stop, take a moment, observe, and think about how it's serving you. I managed to do that in most situations, only because of the space that I've created in those, I suppose, in the brain, I guess.
Yeah, I was just going to say really quickly related to that. So I think personally, I don't believe that there is one way to be in recovery. And I say that as it relates to, I'm sure you guys are familiar that, for instance, like not everybody gets sober going to 12-step meetings and going to AA. There's lots of people that don't relate to it. And there are other, recovery communities that are about managing use, and they're not necessarily about not using entirely. I think that, to me, what is critically important is that whatever you're doing, you're not doing in isolation. So you feel connected to community. And that it's community that you feel like you can be open and transparent and honest about what you're really dealing with. So, I really sort of, when I'm working with someone, encourage them to think about what does that look like? And so for some people, that's a religious community. And for some people, it's a self-help group that has nothing to do with drugs and alcohol, whatever it might be. And in terms of the question about harm reduction and abstinence, so I think there are a couple of things that I think are really important are, I believe, and this probably is a little bit controversial with some people, is I actually don't think of abstinence and harm reduction existing in sort of like two different spheres. I think the reality is that abstinence is a version of harm reduction. It's just a version that means you're not using it all. And that's not how we talk about it. And like, in the world of sort of, folks that live in this all the time, is very kind of, you're sort of one or the other. And I think we could probably have another 4-hour lecture on the history of substances and mental health treatment and how those existed in different worlds, and all the ways that we still don't always play nice together or in sort of a cohesive way. But I think that what I really sort of encourage people to be thinking about is, I think it's important to have so people will come in and say, well, I want to be able to understand my relationship with alcohol or with marijuana or whatever it might be. And I've been using in a way that I'm not comfortable with, but I'm curious about whether there's a version that I can use that is healthy. And I don't propose that I know the answer to that. My recommendation in general, when somebody has an interest in thinking about that, is really that you have a period of time of stability where you do not have any substances that are contributing to that variable. And so, most of the research says that if you want to sort of kind of go into, a moderation management kind of use, that you should have at least 6 months of sobriety before you're doing that. And some people, I've had patients say, like, that's just a trick. That just means that you're not really into moderation management. And at least I can only speak for myself. It's not a trick. It's just the research has shown that, like, there needs to be stability to be in a place where you can have the clarity to actually make those determinations and have the skills and tools you need to address the needs that the unhealthy use might have been contributing to.
Amazing. Those are really great. I've got one more question for you guys. So for people who are in the thick of things, of addiction, of self-medication, I want to just talk for like maybe 2 minutes about the shift to self-care. What is one small, tangible way that they can kick off self-care for themselves today or tomorrow, but something really actionable that people can start? Because we talk, like you said, Tim, we talk about self-care and it's gotten to be this big sort of amorphous thing, and people find it really hard to get into that world. What is one thing what is a place where people can start?
I'll give one suggestion. And that's self-compassion, self-love. When I began to actually try to close the gap on my sort of negative self-talk and positive self, so giving myself affirmations. When I started to give myself affirmations and actually come back to, this, I'm not a bad guy. And I say it literally, I'm not a bad guy. I do love people. I do want good things, because it just helped me to remember who I was. Because so often, because of these behaviors, I was judged as being, a bad guy. You can't possibly love me. You can't possibly love those people. You can't. And I think when I started to realize that actually, drinking or taking drugs in and of itself, it's okay if it's okay. It's not that. It's only not okay if it's getting in the way of who I am. So if it's making people think that I don't love them, or it's making people think that I don't care, then there's a problem. So for me, I'll bring back to self-love and self-compassion to begin with.
Yeah, so I think it's beautiful. And the other thing that I would say is, I think it's about really connecting with people more often than not. When I'm first starting to work with somebody, pretty consistently, one of the questions that I'm asking is, tell me a little bit about your social supports. And people will talk. And more often than not, the answer that I think I probably most consistently get from people is, oh yeah, I have friends, I have a partner, I have neighbors, I have family, whatever. I have people. And they immediately follow it with, but I don't want to burden those people. And so the thing that is so present for me, and it's interesting, because oftentimes I'll ask people, I'll say, that's interesting to hear that you have these people, but you're concerned about being a burden to them. And I'll ask them to kind of put the shoe on the other foot and imagine that one of those people who you've just thought of as part of your support system calls you and says, hey, Matthew, I'm having a really hard time. Can we, can I just check in with you about something? Would you ever in a million years think to yourself, like, oh my God, Matthew is being such a burden? And it's always no, right? Because we have this standard and expectation of, like, we don't want to burden someone else, but we will offer that same support to somebody else. And I think it's really about connecting with people and at least considering, even though it's uncomfortable, the possibility that somebody picking up the phone and having you call them, more often than not, probably has a lot of gratitude that you're actually reaching out to tell them that you're having a difficult time.
Yeah, that's wonderful. So thank you guys. That self-compassion, neither of them said, hey, go run a mile, right? Go exercise. I mean, yes, exercise. I can tell you that all day long. But neither of them said that. They said self-compassion and reach out. And sometimes getting that, that love, that inner love, that outer love is really a great place to start. So thank you. I want to thank you guys so much. What an amazing talk. Thank you both for being here. Truly amazing. We have 2 more amazing speakers, but